Good afternoon. I'm Dr. Joss Reimer, Medical Lead for the Vaccine Implementation Task Force. Today, I am pleased to announce that eligibility continues to expand for the vaccine. As of today, we are expanding eligibility to include people aged 50 and over and First Nations people aged 30 and over. They can now make an appointment to get the vaccine at a super site or pop-up clinic. Beginning today, following the guidance set out by the National Advisory Committee on Immunization, we are also opening up eligibility to include frontline police officers and firefighters. À compter d'aujourd'hui, conformément aux recommandations du Comité consultatif national de l'immunisation, nous élargissons l'admissibilité au vaccin pour inclure les intervenants de première ligne, c'est-à-dire les policiers et les pompiers. Work continues to establish our community-based prioritization, where all adults aged 18 and over who live in specific geographies will be eligible for immunization. I expect to be able to announce the first communities prioritized later this week. Nous poursuivons notre travail pour dresser la liste des collectivités prioritaires. Tous les résidents adultes de 18 ans et plus seront admissibles au vaccin. J'espère pouvoir annoncer les noms de ces premières collectivités prioritaires plus tard cette semaine. These decisions are being based on an analysis of COVID-19 rates, population density, percentages of racialized populations, income, and suitable housing in those areas. When those communities are announced, the people who live there will of course be eligible, but also some people who work in specific jobs in those communities, even if they live elsewhere, will also be eligible. Today, I can tell you those jobs will include people who work at schools, as childcare or daycare providers, in food processing facilities, at grocery stores, convenience stores, or retail gas locations, and anywhere that serves food, including restaurants and food banks. As this work is complete, we will update people in the bulletins and online, so more information will be provided later this week on the details of who can book and when. But I do want to be clear that when we're talking about workers, we're talking about the workers who are working in the specific priority geographies when those are announced. This week, we also announced that the eligibility criteria for AstraZeneca has been expanded to include all people aged 40 and over. There have now in Canada been 2 reports of blood clots with low platelets in people who were vaccinated with AstraZeneca. So we know that even in Canada, these numbers are very, very low, and the rates it's very rare. Based on all of the evidence that we have internationally to date, we continue to believe that the benefits of AstraZeneca to protect against COVID-19 outweigh the potential risks. This is because the risk of COVID-19 is greater than the risk of blood clots related to the vaccine, particularly for age groups now eligible. So I want you to imagine if we were picturing 1 million people who are aged 40 to 49, and all 1 million of them went and got the AstraZeneca vaccine. The numbers that we're seeing from the UK tell us that about 5 out of those 1 million people would experience the blood clots with low platelets. I also want to highlight that this is a treatable condition, and so the 5 in 1 million is still much smaller than the risk of blood clots from many other things, such as smoking, or taking birth control, or being pregnant, and certainly lower than the risk of having a blood clot if you are infected with COVID-19. Now, going back to those same 1 million people, I want you to imagine them again, and they did not go and get the vaccine. They chose not to be immunized with AstraZeneca. Of those 1 million people, we expect that nearly 60 of them would end up in the ICU related to COVID. So the comparison that we're looking at is 5 out of the 1 million people would end up with a blood clot if immunized, but 60 out of those 1 million would end up in the ICU if they choose not to be vaccinated. And this estimate comes from the UK in their lowest risk scenario with low levels of virus circulating. So the more virus that we have, the stronger that difference becomes. So I know as a doctor and as a public health doctor that the benefits of these vaccines, and by this I mean all of the vaccines that are available to us, far outweigh the risks. But I do understand that people have questions and may have concerns. This pandemic has given us a lot to handle, and the vaccine is no different. But I do worry that people who aren't sure won't take the opportunity to be immunized and therefore leave themselves at risk. Je comprends que les gens ont des questions, qu'ils peuvent aussi avoir des inquiétudes. Nous avons beaucoup de choses à gérer avec la pandémie, et le vaccin ne fait pas exception. Toutefois, ce que je crains, c'est que les gens qui hésitent à se faire vacciner ne profitent pas de cette chance qui leur est offerte et qu'ils exposent aux dangers que présente la COVID-19. Throughout Manitoba, in every region, we are seeing case counts and trends that look very much like our situation in October. Case numbers are rising quickly, particularly among younger people. Our shift to an 18+ approach in some communities will help, but even that is limited by the amount of vaccine we will have in the weeks ahead. Even with vaccines, we could see cases increase very quickly, leading to another lockdown. So if you are currently eligible, make your appointment, get your vaccine as soon as possible, whatever vaccine you are eligible for. And before I wrap up my part, I also wanted to congratulate our community partners on the 5 urban Indigenous clinics that will be opening soon in Winnipeg, Brandon, Thompson, and Portage la Prairie. These will be culturally safe spaces in locations and with partners that are well respected and trusted by their communities. The Aboriginal Health and Wellness Centre of Winnipeg, Mamawi Wiichta Centre, Portage la Prairie Community Revitalization Corporation, the Brandon Friendship Centre, and Mamawitak Friendship Centre. They will help address systemic barriers that people may face in accessing the vaccine. Many of these sites will also help support the immunizations of people who are homeless or precariously housed, in conjunction with further work that we will do with our focused immunization teams. This is incredibly important work. As we have said, we must get the vaccine out to as many people as possible, as quickly as possible. But we also need to ensure that we find solutions that get the vaccine to people who are at greater risk and who may face barriers to being immunized. And that benefits all Manitobans. So thank you to everyone at all of those centers and everyone else on the team who is leading this effort. For all of us in Manitoba, our actions are critical in fighting the effects of COVID-19. We can do this together, but we need to comply with the new public health orders, keep following the fundamentals, and get immunized as soon as it's our turn. And with that, I will turn it over to Johanu.
Good afternoon, everyone, and thank you very much, Dr. Reimer. I am Johanu Botha, the Operations Planning and Logistics Lead of the Vaccine Implementation Task Force. We continue to implement our plans so that we can immunize as many Manitobans as quickly but as safely as possible. As of today, 364,389 doses have been given to Manitobans. We have also surpassed another milestone. More than 1/4 of Manitobans 18 and older has received at least 1 dose of the vaccine. As of today, that figure sits at 27.3%. Today alone, we expect to give well over 7,000 doses, and we will completely exhaust our vaccine supply we have on hand today within a week and a half. I want to be clear that each and every one of the doses shipped to Manitoba is planned for. Last week I told you we want to meet the expectations that Manitobans have set for us by doing everything we can to get those needles into arms. Earlier this week, that meant we redirected vaccine to a 3-day pop-up clinic on Notre Dame Avenue in Winnipeg to ensure pop-ups can use their allocated amount quickly. We have been able to do this while running pop-up clinics in communities identified across the province where people might otherwise have faced barriers in getting to the super site. This week, we expect to give over 13,000 doses in these pop-ups and well over 34,000 doses in our super sites. This does not include all the doses being administered each day by our First Nation partners and through our distributed channel by doctors and pharmacists. Beginning today, people can now also choose to book their vaccine appointment at our second super site in Winnipeg, located on Lila Avenue, which will officially open its doors on May 7th. We hope this is another option that makes it easier for people to get their vaccine at a location closer to home. Once it opens and ramps up as more vaccine arrives from early May onwards, the Lila super site is expected to be able to deliver thousands of doses a day. The team is also continuing to drive down the number of doses at all of our super sites every week before our next shipment of Pfizer arrives. We're continuing to closely monitor our distributed model with medical clinics and pharmacies, alongside the overall success of our approach to immunizing Manitobans. Before I go to questions, I do want to acknowledge that April 18th to 24th is National Volunteer Week. We are fortunate to receive support from volunteers in vaccination clinics across our province. They assist staff in providing a positive experience for all the Manitobans who come to experience their vaccination at a super site. Volunteers handle many different tasks, such as screening or greeting clients as they arrive, answering their questions, helping with traffic flow, sanitizing our clipboards and pens, and other duties that they may be assigned to. With some anxiety felt by Manitobans arriving for their vaccine, volunteers are another layer of kindness and support during that time. Thank you to all of our volunteers this week, every week, and for the rest of this campaign. You are making a difference, and with that, I will turn it over to questions.
Thank you. We begin today with Global and Brittany.
Good afternoon, Brittany from Global. Dr. Reimer, my first question is for you. When we talk about the hot spots and people who work in those hot spots that will soon be eligible, what kind of proof, or will they need proof to show that they work in those areas? Will they need some form of letter or identification, or how are we going to ensure that the people that are eligible are the ones that are actually getting these appointments?
Yeah, so we're still finalizing the details of how we're going to roll out the hotspot or the priority geography approach. But much like we did with healthcare workers, certainly we're going to be expecting that Manitobans do affirm that they are part of the workforce that they say they are. And that's part of the booking, whether it's online or with the call center. So we plan to follow a similar mechanism that we did with healthcare workers for workers in these areas, with the final details to be determined when we announce the geographies.
Thank you. And we've heard from obstetricians in Ontario that they have more pregnant patients in the ICU than they do in their own care right now. What are we seeing here in Manitoba when it comes to pregnancies and severe cases and people in ICU, and why are they not being prioritized?
That's a great question. So thankfully, our numbers are still quite low in Manitoba. So we're not seeing any obvious trends that puts pregnant people at higher risk in Manitoba. We've seen as well in the news the reports from docs who work in ICUs in Ontario that they're seeing higher rates. And so our team is looking at the numbers to see what the data shows in those other jurisdictions. And like we do with every other risk group, we are going to be analyzing this and open to changing eligibility if we see something that becomes clear to benefit Manitobans.
From the Brandon Sun, Kimberly.
Good afternoon, Dr. Reimer. My question is for you. How do you think increasing the numbers of vaccines has affected the provincial death rate?
Yeah, well, it's a very difficult question to answer clearly because as we've had the vaccine rollout, we've also had the appearance of variants of concern. And so having both of those happening at the same time makes it a bit more challenging for us to truly see what positive impact the vaccines have made. What I would note, certainly though, as an example of where the vaccines have been extremely successful, is in our personal care homes. We have seen the rate of outbreaks plummet in our personal care homes. In fact, in Winnipeg currently, there's only one resident in any personal care home who has a COVID infection. And that's remarkable compared to the types of numbers we were talking about only months ago. So in some of these areas where we do have more or longer data, we've seen excellent outcomes. And as we move forward with these variants, we will be trying to analyze to see how the vaccines are helping compared to what we would have seen with the variants without the vaccine. But I do want to be clear that we have every confidence in this vaccine that this is the way to reduce hospitalization, reduce people ending up in the ICU, and reduce deaths in Manitoba. And so we really want everyone to get vaccinated as soon as possible.
Thank you for that. And one more question, Dr. Reimer. Why is the number of COVID-connected cases in ICU increasing while the number of hospital active cases are going down?
Yeah, so that's probably a better question for Dr. Rusin, who's been working with Lynette Siragusa on hospitalization data. Certainly the variants of concern create a different clinical picture than we saw with the original type of COVID. And so we may be seeing different trends in the hospital related to who ends up in the ICU. But that's something that, I'm going to let the chief answer with some better data that he can bring forward.
From CJOB, Skylar.
Thank you for your time, you two. I have a question about how you prioritize certain professions. Was there any data that shows folks that work in restaurants or food processors were more at risk than folks left off the list, like transit drivers, for example?
Yeah, there was a combination of factors that went into how the professions were chosen. Part of it was the clarity of geography and how well defined somebody's role could be in that geography. For some of the professions, there was very clear data showing that they have experienced higher rates of transmission as well as of severe health outcomes. And some are more related to the goal of preventing further transmission in these settings. And so jobs where we see a lot of interaction with the public could be an area that we want to target in order to reduce the height of wave 3. So we have seen outbreaks in a number of the settings that we announced. And so all of those factors had to go into the discussion. But we are still looking at other worker categories as well. And as the number of doses we have available expands, we do have the option of including workers in the future as well.
Thank you for that. Johanu, this one might be for you. Pfizer doses are really picking up in the next couple of months. Could you give us a short breakdown of what's ahead in May and June, and the new target dates for all Manitobans or 70% of Manitobans that are eligible to get vaccinated?
Absolutely. So we'll do the Pfizer piece first. There's some really good news on the Pfizer supply chain. Starting early May, we should be seeing at around 70,000 Pfizer doses coming into the province at a weekly rate. And then by the end of May, closer to or over 80,000. That's sort of the approximate figures. It's a doubling of what we have seen up to this point for Pfizer coming in each week. It's also nice to note these are confirmed shipment deliveries until at least early June, which means that it really allows us some comfort in terms of planning. Most of this supply will be going through our super sites, which by the end of May will include quite a few new ones. So we'll be able to use the supply. We will have the capacity to use the supply and get doses into arms faster in terms of that Pfizer supply. That's the good news. At least for the short term, the less good news is that we don't have clarity from the federal government at this time on Moderna shipments, apart from the one that should still come in by the end of this month, and nothing new in terms of AstraZeneca shipments. So when we look at when all Manitobans might be immunized with the first dose, we still have to incorporate those federal estimates of a robust supply and a weaker supply. And so we do have some new dates on that. The way that we get to it is sort of as of today, we have 27.3% of adult Manitobans having been vaccinated. That leaves us with 42.7% of adult Manitobans who must receive their first shot for us to get to that 70% uptake, which means about 459,000 additional first doses needing to be administered starting tomorrow. So that's the lay of the land, the challenge in front of us. If we have a low supply overall, given the picture that I just painted of the various vaccines coming in, then we will be complete in terms of those eligible Manitobans having the option June 9th. If we have a high supply, we should be complete June 5th. So it's not a massive difference between the two at all. I think all roads are pointing to early June, so it's good. But eagerly waiting for confirmations of Moderna shipments and AstraZeneca from the federal government as we move along.
From the Winnipeg Sun, Scott.
Hi, good afternoon to you both. Just kind of building on the AstraZeneca vaccine, I suppose, shortage or just no line of sight on those new doses. There's worry from people that have gotten their AstraZeneca vaccine, Scott, and I know, Johanu, you spoke of this morning, but can you just reiterate to the public the messaging on the span between first and second doses, and is there a worry for those people that have gotten the AZ vaccine so far?
So I'll talk about supply chain and then go to Dr. Reimer on delayed second dose. I want to be very clear that this supply chain pressures that we're feeling at the moment is a short to medium term pressure. All the signals from the federal government has been very clear that every one of these vaccines will see a stable and robust supply chain going forward. So if individuals are considering to go to receive a vaccine, or if they've had a vaccine, there will be enough supply over time for everyone to get their second dose. That is not a concern. The concern right now is simply about getting doses in arms quickly for those who haven't gotten a vaccine yet. So the supply chain will stabilize across all those vaccines, and likely with some other ones that we don't even have in the province yet. In terms of the two doses and that risk, Dr. Reimer, maybe I'll just pivot to you.
Yeah, certainly our expectation overall is that we will have a wealth of supply of all of the vaccines when it comes time for dose 2. What we've seen right now, because of the export ban in India, is that we don't know when AstraZeneca is coming. So it's still being produced. It's not a matter of there not being doses in the world. It's really a matter of India not allowing those doses to leave their borders. We do expect that will change. India will be allowing doses to leave. It's more a question of when. In the off chance that we end up in a scenario where we don't have AstraZeneca in time for the second dose, we have options. We can look at offering an mRNA for dose 2. We can look at if Johnson & Johnson or Novavax is available at that time. We can also look at delaying the length of the interval between dose 1 and dose 2 longer. So none of those decisions have been made at this point because there's just so many unknowns about what will be available and when. But my best guess today is that we will have all 4 products, potentially 5 if Novavax comes online when it comes time for dose 2.
Thanks for that. And just going back, there's an early question about how the vaccination program is impacting, I believe it was hospitalizations or deaths even in the third wave. How do you suspect that, 360,000 somewhat people today at least with first doses will impact the impact of those third waves?
I think there's no question that the vaccination program is going to reduce the height of wave 3. We have 27% of Manitobans who are likely, most of them, immune to the virus. That's a huge portion of our population, and most of them are older, and we're more likely to be admitted to hospital or more likely to die related to COVID. So there's no question that this vaccine program will be saving lives as we speak in wave 3. It just becomes a bit tricky to quantify and give an exact estimate of how many lives being saved because the virus is different this time around. And so doing a direct comparison is difficult. Our approach is slightly different than it was in the fall also. So a lot of factors that play into the exact numbers, but there's no question in my mind that many lives will already be saved because people who were at the highest risk of those severe outcomes have been immunized.
From Radio Canada, Sophie.
Hi, good afternoon. Do you have something in mind for Manitobans who will participate to the Olympic Games? If so, what is the plan?
I think that was that an eligibility question around whether Manitobans who might become Olympic athletes are eligible for the vaccine? Was that the question?
Yes, that's it. Yeah.
Yeah, we haven't had any discussions around prioritizing athletes in our vaccine campaign. Athletes are some of the healthiest people in Manitoba and least likely to have those severe outcomes. So in our focus on severe outcomes, that has not been a priority. Soon, we will be starting to shift more towards the approach of achieving herd immunity and affecting transmission. There's no point in aiming for herd immunity when you only have enough doses to cover 10% of the population. But once we start getting to half of the population being immune, the approach can change a little bit to also try to focus on transmission. And so that's one of the reasons why we're moving to the priority geographies, is to interrupt transmission as early as we can, while also trying to still target those who are highest risk. But as with every other topic, nothing is off the table, and we certainly can take any suggestions away and bring them to our tables to discuss.
Thanks.
And I'll assume no follow-up, Sophie. Moving to CBC Manitoba and Bart.
Hi, Dr. Reimer. Can you just go over the epidemiology for detail about how you're choosing the high-risk areas? You mentioned this morning, based on the highest risk of the most infections you saw in waves 1 and 2. Wave 1 really didn't exist. Why not look at more recent epidemiological data? Can you just talk a little bit about the specific epidemiology around those choices?
Yeah, so we're looking at a number of different factors. We are weighing the epidemiology greater than any other factor, and we're looking at the numbers related to wave 2 and 3. So starting with October is when the index is including cases to help inform the priority areas. The epidemiology around wave 1, as you mentioned, was very small in Manitoba and was quite a different population than what we've seen for the rest of the year. So starting with October, where the numbers were much larger, was more applicable to what we're seeing today, as well as more reliable just based on higher numbers and less susceptible to chance. So that's going to be the biggest factor in how geographies are chosen, is the number of cases that they had in wave 2 and wave 3. But together with that, the other factors that will be considered in this index are population density, income, sufficient housing, the proportion of racialized populations, and all of these factors together will help us come up with a list of the highest priority communities where we feel that the most risk of both spread and severe outcomes could be occurring.
Yeah, thanks for that. Mr. Botha, do you have a target for total vaccinations per day in the coming weeks, not just at the super sites, pop-ups, and mobile teams, but like total. I mean, we're probably going to see the numbers soon reflect the pop-ups earlier this week in the AstraZeneca moving through the system. But right now, today, 13,000, we've got a bit of a rolling average, but what's the target per day, realistic target per day for next week and the week after?
Thanks, Bart. So in part, it is a difficult question to answer because it will require us to make an estimate for how many doses our physician and pharmacist partners are administering each day. And as you know, there are around 300, if not now more, clinics and pharmacies of various capacity and throughput across the province administering AstraZeneca. So it'll require an estimate as opposed to looking at our own booking system, which gives us very hard figures for the pop-ups and the focused immunization teams and the super sites. And then, of course, we will have to include what our First Nation partners are doing on any given day, the operations of which are under their purview. But I think what we can do is we can safely say that if we look at how doctors and pharmacists have been able to administer AstraZeneca, especially given the recent eligibility change to 40 plus, is over Monday and Tuesday, there was over 6,000 administered. And if that rate continues, between 3,000 and 5,000 a day until that stock is depleted, you can add that amount to our channels, which are usually between 7,000 and 10,000 going forward. And then we add our First Nation partners. So I don't want to lock into a specific figure now. Maybe that's analysis that we can do for Manitobans. But you can see that there are going to be few days going forward where the total amount of doses being administered on any given day is less than 10,000. And we're probably going to get into a very steady state of 15,000 soon.
From the Canadian Press, Steve.
Oh, hi there. Dr. Reimer, I'm wondering if the province is going to return at some point to having lower age categories for people with underlying medical conditions. We had that briefly with the AstraZeneca, and I think some people in their 20s and 30s are now wondering, well, if I have certain underlying medical conditions, am I going to be prioritized?
Yeah, so we haven't made any decisions about if or when other health conditions will be considered. So much like the question around pregnancy and the reports we're hearing from Ontario, we do have tables that are looking at this all the time. Our medical advisory table has over 30 physicians from a large variety of specialties, including infectious diseases, public health, immunology, obstetrics, as well as some nurses and pharmacists. And that is the group that really focuses on health conditions and the risks related to those health conditions. And I expect that table will continue to assess and make recommendations about if there are particular health conditions that are demonstrating themselves to be very high risk for people under 40. So while there's nothing today as far as the plan for that rollout, that table will continue to look at it.
And over the past several days, we saw a case where Health Canada was saying, it's okay to use AstraZeneca on younger people down to 40. The National Advisory Committee was not recommending it, and in the general public, there was obviously some confusion or mixed signals there. Do you think there's an improvement that could be made to the Health Canada versus the Nazi group regime?
Yeah, I can certainly see why Canadians would find it confusing. Normally, the Canadians don't pay close attention to the difference between what Health Canada has approved and what NACI is recommending. And now there's a lot of attention on it. So, I'll let the federal government take the decision-making about how best to communicate what they are doing, but do want to make it clear for Manitobans so that they can understand a bit better about what the federal government is telling us. Health Canada is the body that approves the use overall. So they approve the use of pharmaceuticals as well as vaccines, and they focus largely on safety and a little bit on efficacy. But their job is to make sure that the products that are being presented to Canadians are not going to cause harm to Canadians. But what they don't do is look at the costs of things. They don't look at the benefits of using something in one age group versus another. They don't look at risk factors and when certain products should be used for different people. And that's where the National Advisory Committee on Immunization comes in, because they try to analyze many different factors to give Canada the best possible advice on how we can use the vaccines in the best way possible. And that goes beyond the COVID vaccine. They do the same thing with measles, mumps, rubella, tetanus, et cetera, et cetera. And so that group of experts gives us a more fulsome analysis of how to use these resources to provide the best outcome for Canadians.
From CTV, Michelle.
Hi, Dr. Reimer. I'd like to ask you about Bell's palsy following immunization. We've heard that a handful of people in Manitoba have experienced this following a COVID-19 vaccine. Can you just tell us about how common this is and if people should be worried if they have someone in their life where they experience this?
Yeah, so Bell's palsy is something that is possibly linked to vaccines, although we've never been able to clearly outline the what we call the pathophysiology, or the physical path that creates this outcome. And so we do watch for it related to all vaccines. We've seen that there have been a few cases after a COVID vaccine, but the number of cases after a COVID vaccine has still been lower than what we see in the general population. So Bell's palsy can also occur after an infection. So COVID infection would be a great example, but really any viral infection seems to be a risk factor to trigger Bell's palsy. And some people get it with no risk factors at all, where we don't know why they went on to develop Bell's palsy. So even though we've seen a few cases after the vaccine, because we know that it can occur just on its own, we have to be very cautious before concluding anything related to the vaccine. And that's why we do have folks who watch the adverse events following immunization and compare that to the normal rates of different outcomes in society. And so we've talked with those folks, and they're telling us that right now the number of Bell's palsy cases after COVID is the same or lower than what we would expect to see if we were talking about the general population.
Thank you. One organization suggests part of the rollout should include sending nurses out into the community where precariously housed or homeless people are, as opposed to gathering up people or getting them to go to a shelter or to a clinic. Do you have any thoughts on this strategy?
I think certainly the more we can bring vaccine to people, the more convenient it is for them. And that becomes particularly important in people who face barriers to going to clinics. Unfortunately, the mRNA vaccines, Moderna and Pfizer, are logistically very challenging. One of the things that the manufacturers have made very clear to us is that they have strong limitations on how we can transport the vaccine. We did specifically ask, could we do a door-to-door campaign? And they told us that they did not recommend that we used their vaccine in that mechanism because they couldn't guarantee that once the vaccine was in a syringe, that the disruption, the shaking that would occur as you're walking from one house to the next and across streets, they didn't have any mechanism to confirm that that wouldn't decrease the effectiveness of the vaccine. And the last thing that we want is for our team to be bringing an ineffective vaccine to people who already experience so many barriers. And there wouldn't be any way for them to know whether or not the vaccine had been damaged in the transportation. So AstraZeneca, Johnson & Johnson, and possibly Novavax are more flexible. They can be stored in the fridge, and they're less sensitive to shaking. And so it's certainly something we can explore once we have more doses of those. But right now, that makes up a very tiny proportion of all the doses we've been given in Manitoba. So we haven't been able to be nearly as flexible as we would like to be, hopefully in the future.
From City TV, Stephanie.
Hi there. I'm just wondering about these priority communities that will be identified on Friday. How are we going to reach Manitobans in some of these communities, especially if they are remote? I'm not sure yet because they haven't been decided on, but how are we going to reach them if we have no future shipments of Moderna, the most mobile of the vaccines, confirmed moving forward?
Yeah, so I think there's two separate questions in there, and maybe I'll talk about the eligibility first, and then let Johanu talk about the rollout aspect. So we are trying to reach communities where we have seen and think we will see a lot of transmission of the virus, as well as a lot of those severe outcomes that we really want to prevent. And so the populations that tend to experience more transmission and more severe outcomes are often also those who have a lot of barriers to getting to a clinic. But the first barrier is whether or not they're eligible. So it doesn't matter if we can take doses to people if they're not eligible through our approach to receive the vaccine, that no longer is relevant. So the first step that we needed to do was to establish a mechanism to make certain communities eligible. But that's by no means where we stop working. I think after the eligibility is set, we can turn over to our operations team to work with these communities to figure out how best to reach them.
I think that essentially covers it really well. We want to be able to ensure that the operations side can support the strategy from the medical side. And the first option, as Dr. Reimer had said, is once someone's eligible, they can call in to make an appointment at a pop-up or at a super site. The pop-ups in more remote areas certainly do use Moderna, and the North exclusively uses Moderna. Moderna is not halting as a shipment. We're waiting for a confirmed delivery into May, and I anticipate we will get that confirmed shipment. There is another one coming at the end of April. It certainly will likely support this strategy from Dr. Reimer and the medical side. There certainly will be Moderna in there that can go to a pop-up that is in one of these hotspots. But also, I mean, I anticipate the epidemiology side is Dr. Reimer's side, but I anticipate that many of these hotspots might be in urban settings that can be better served by a super site using Pfizer in the southern part of the province. Or in some cases, despite all the difficulties in transporting Pfizer, it can be moved in certain urban cases where all the shaking and the challenges that Dr. Reimer has elaborated on isn't so much of an issue. So I anticipate we will be able to use Pfizer to support some of these hotspots to the degree that they happen in an urban context. And I guess I should close off with say that nothing is off the table as different vaccines become available, especially AstraZeneca. That's easier to maneuver about. We will be even better situated to support this hotspot approach.
Okay, thank you for that. I wanted to go back to something that was asked earlier. I just wanted to see if you could provide a little more clarity of how sure you are that Manitobans who already gotten the AstraZeneca will be able to get their second AstraZeneca dose. Kind of when will we be looking at giving that second dose? How early do we need it? And I know there's a lot of uncertainty with this whole process, but how sure can you be, and what are some of the possibilities that might be explored if they're not able to get that second dose on time?
I think I'll just reiterate that our signals from the federal government are very clear that we will have a robust supply of AstraZeneca that will come in to allow everyone who's had a first dose of AstraZeneca to get their second dose. We will have that supply come in ultimately. But maybe Dr. Reimer, I'll go back to you in terms of the efficacy piece.
Yeah, I mean, on the off chance that something happens, because we do know that vaccine supply chains are unpredictable. We've seen that several times throughout this campaign. we do need to think about other options. I don't anticipate we'll need to use any of these, but certainly we have already had conversations about options like offering an mRNA for dose 2, or if we have Johnson & Johnson or Novavax, offering those for dose 2. We also have the opportunity to delay the second dose further for individuals if we see that more AstraZeneca is coming in the future. So there's certainly options available to be considered. One of the things I'll highlight is that even without the provincial approach to delay the second dose, AstraZeneca has been shown to be more effective when you wait more than 12 weeks in between doses. So even if we start doing second doses in Manitoba, for those people who received AstraZeneca, it's beneficial for them to wait 12 weeks or longer in between doses to get the best result from that vaccine. And so, we have just started to administer AstraZeneca and don't have anybody who's close to the 12-week mark at this point. So we've got time to see what happens with these supply chains and to hopefully confirm what we already are being told by the federal government, that we will have a lot of doses available when it comes time for dose 2.
From CHVN, Taylor.
Hi, good afternoon. Earlier, new public health orders came out saying that personal care home staff will need to be double dosed with the vaccine to work at more than one care home. But how is this going to work when the province is currently only offering that first dose?
Yeah, so again, this is more a question for Dr. Roussin and that team, but what I can say is that personal care home workers became eligible for the vaccine when we were offering the second dose. So for those folks who booked an appointment prior to when we announced that we were delaying dose 2, they would have already had their second dose appointment and their second dose given. So many of the individuals in personal care homes will have already received 2 doses because they were eligible before we changed things. But for the plan for those people who can't get a dose 2 right now, I have to leave that answer to Dr. Roussin.
Thanks. And there's some vaccine envy going on right now after all of the news that came out this week. What messages do you have for those who are wanting a vaccine but are waiting?
Yeah, I mean, I'd say we're so happy that Manitobans are so eager to get the vaccine. All of us on the task force get a little overwhelmed by messages from people wanting to be eligible. And we would, right now, if we could, offer a vaccine to every single person in Manitoba. So for those people who are still waiting, we ask that you keep following the fundamentals. And sign up on protectmb.ca so that as soon as you're eligible, you get that notification. And in the meantime, become educated on the vaccine, learn about the risks and the benefits, and help us reach out to those people in your life who are eligible. There's lots of folks who just haven't gotten it quite to the top of their to-do list yet. And so if you're that eager to get your vaccine, why not help somebody else get it to the top of their to-do list and get them immunized, because that's one less person who can spread the virus to you. But we're seeing a doubling of the Pfizer doses coming in, and so I think that most people are going to become eligible a lot faster than they think, and we just can't wait week after week to be able to announce more people who are eligible.
Our final reporter today, Danielle from the Winnipeg Free Press.
Good afternoon. Dr. Reimer, last week in a press release, the government committed that the first eligible communities would be announced on April 21st. Why is that not happening today? And were you caught off guard by that commitment?
That was my hope as well, is that we would be announcing the communities today. We actually had the team take a second look and do some additional validation. So we have a statistician who's looking at the numbers and the index to validate it, to make sure that it does predict transmission the way we think it does, because we want to get it right. While we know more Pfizer doses are coming, we still want to make sure that the folks that we are prioritizing are really the ones who are at highest risk. And so the 3 days that we had between when we announced this new direction and today, just didn't give us quite enough of the analysis time to make sure that we had the right communities. So we're still planning to go ahead this week, and we want to announce those communities as soon as possible. But the delay of a day or two is really around making sure that we got it right, or at least that we got it as close as possible to what is really going to happen when this virus starts circulating in our communities.
Okay, thank you. And earlier today, you said the province has yet to determine how many people will be offered immunizations through the geographic prioritization. But based on estimates, can you say how this change will affect the timeline for people to become eligible in communities that are not prioritized? Will it be a matter of weeks or days that their eligibility is pushed back?
Yeah, I think we're probably talking about a week or two difference in eligibility, maybe a few weeks at most, because we're getting so much Pfizer coming in. And so, it's still critical that we reach people as quickly as possible, because we're right, into that beginning of this third wave, and this is the time where we might be able to make a big impact if we can get vaccine to the right neighborhoods. So there is a possibility that some people based on age will have eligibility delayed a little bit. But I also want to highlight that as we get into younger age groups, things will speed up again, because some of those folks will already have been immunized. So the delay is really only temporary, and we will catch back up because so many Manitobans will be immunized. And even for those individuals who are going to have eligibility a little later than we originally thought, this is still beneficial for them. If we can keep transmission rates down, that means less public health measures. And so, for somebody who is younger and not in a priority area but runs their own business, if we can keep it so that their business stays open, that's still a benefit to them. And if we can keep the numbers down so that the virus never makes it to their community, that's still a benefit for them. So this approach is intended to benefit the whole province, and we're trying to be as strategic as possible to get to those benefits for both the people who will be getting the vaccine through the priority geographies, but for other people as well.
Thank you, everyone. This concludes today's media briefing.